Hi, my name is Dr. Megan Esch. I'm a neurologist at Geisinger Medical Center, and my specialty is multiple sclerosis. The diagnosis of MS is made by using a number of different criteria. First and foremost, a patient will present to me a number of symptoms that they may be experiencing. And the symptoms can range from weakness on one side of the body. They can have sensory changes, so numbness or tingling. They can have vision loss, and all of those things are very concerning. And so if a patient comes to me with those symptoms and says, I have some concerns, we would then do a few tests. And some of those tests include imaging of the brain and the spinal cord. So you would actually undergo MRI, magnetic resonance imaging, and we would look for certain characteristics on the imaging that may be consistent with a diagnosis of MS. And after we look at the imaging and consider also the symptoms that the patient presented with, we may need to do a study called a lumbar puncture. The lumbar puncture is looking for specific proteins that may be associated with where there is breakdown in the central nervous system. And so by taking clinical symptoms, magnetic resonance imaging, and the results from a lumbar puncture, we can make a pretty definitive diagnosis of multiple sclerosis. The Federal Drug Administration has approved 14 medications that are used in the treatment of multiple sclerosis. These are referred to as disease-modifying therapies. We work closely with pharmacists in our MS clinic to ensure that the right treatment is being prescribed to each and every one of our patients. So the treatment is really very individualized. We will discuss the side effects of the medications. We will discuss how effective the medications might be, depending on how aggressive your disease is. The medications are designed to prevent your immune system from attacking the central nervous system. When your immune system attacks the central nervous system, there's inflammation that is created, and that inflammation causes breakdown of the protective coating that allows your nerves to communicate with your muscles and your skin and your visual centers. So the severity of MS is really variable. Patients can have very benign MS, where you can barely even tell that they have symptoms. Mild MS, where they might notice the symptoms that come up more when they're warm, they're overheated, when they're very stressed out, or when they're sick. And there are also the degrees of MS that are very severe, where a patient might require a wheelchair and may not be able to walk around on their own anymore. Actually, for all of the different forms and levels of severity of MS, we recommend that patients implement lifestyle changes so that they can prevent any worsening and progression of their disease. A number of the lifestyle modifications that we ask our patients to employ are not smoking. So smoking can actually increase the risk of progression of disease. Smoking can worsen cognition related to multiple sclerosis. And so we ask patients to cut back or to quit completely, and also to avoid people in their lives who smoke as well. Another way that we implement lifestyle changes is by asking our patients to exercise. So there's very good evidence that if patients exercise 5 days a week, 30 minutes a day, and implement things like cardiovascular exercise, stretching and yoga, and strength training, that we can actually change the way the brain looks on their MRI. By exercising, you actually can improve your long-term cognitive outcomes, and exercise is a form of increasing what we refer to as the neurologic reserve. And so if you're feeling poor, if you're not feeling very well, having a baseline good level of exercise and good level of functioning can actually improve your long-term outcome with MS. There's a lot of good research that's being done on diet in MS as well. And while there's no one recommendation for a diet that can cure MS or a diet that can make all of your symptoms go away, we know that a diet that's balanced, that cuts out on sugar, that uses a lot of good protein and healthy fats, similar to the Mediterranean diet, may actually help with some of the restoration of cognitive functioning, motor functioning, and enable the patient to do things that they may not have otherwise been able to do. If a patient is having unexplained or concerning symptoms and you think that you might have multiple sclerosis, the first step would be to visit with your primary care physician. There are a number of conditions that can actually mimic MS, and so it's important that we rule out other things. Rheumatologic disorders, psychologic disorders like depression can mimic a lot of the symptoms of MS. Fibromyalgia can mimic MS. So the first thing is to really contact your primary care physician and establish with them whether or not this is something that should be concerning. If you're still having symptoms that you think may be MS, or that your primary care physician may think may be MS, then you could have a referral to a neurologist. And if the suspicion is still very high, they may send you to a neuroimmunologist like myself.